Plenary number 3, health workforce. Health workforce development, engagement, and recruitment to ensure that we achieve universal healthcare coverage. So when you talk about healthcare workforce development and healthcare workforce as a strategic pillar within the WHO, the health system pillars is key that to ensure we have equipped health workforce that is able to deliver on that mission. And therefore, one of the key things we have to acknowledge generally from a statistical standpoint, 3% of the global healthcare workforce is in Africa, with 25% of the disease burden. Kenya is not exempted from that. And also when we look at it from the WHO numbers that are expected, we are falling far much behind in terms of the targets in the physician to patient ratio, pharmacist to patient ratio, nurse to patient ratio. Generally, we are not meeting the standards. And the question we need to be asking ourselves is, how do we ensure we have enough human workforce to deliver healthcare services? And two, these people, the professionals who are equipped, are able to actually deliver the services. They are employed, they are empowered, motivated, and engaged in delivery of healthcare services. That would be a critical thing for us. And on this particular session that we'll be having, experts will be sharing their perspective from professional societies and associations to training institutions. And the most critical thing, as a young person, what you need to ask yourself is, you're going into a university, you're going to pursue a medical course. Are you going to get equipped with the skills that are needed in the market? That is the first thing that you need to know. And beyond getting equipped with the skills, is there an opportunity for you to apply these skills and deliver healthcare services? Because at the end of the day, you don't need a skill that you're going to keep at home. We need to use those skills. So these are some of the discussions that we need to have. Then once you're employed, are you going to get room for you to specialize and be an expert in your line of work? Because your expertise and professional development would be key in terms of how healthcare services over time will become achieved and actually will be delivered to impact societies. And we're hoping that is going to be a reality, that you're going to be able to get into a school and learn knowing that your skills will be of use. And once you get out of school with the skills, then you'll get a job that will enable you to use those skills. And in that job, you'll be able to gain mastery. You'll be able to get opportunities to develop yourself. You'll be able to serve your patients and believe that the services that you're offering are of impact to the society. And long term, we'll be able to have the required numbers of healthcare workers who are meeting the needs of the public that we're serving, and that will be a sustainable future for us in achieving universal healthcare coverage. So you feel that these are some of the things, the questions that you have in terms of whether you're going to being trained right, whether you are going to be employed, whether in your employment you'll be able to grow professionally. These are questions we need to answer together and ask together. Join us for the second annual Youth Voices Summit at Amref International University. Let's have this conversation and engage and commit to see how we make it a reality moving forward. Thank you so much, and let's engage. Thank you.